Approximately 1 in 5 patients experiences an adverse event within 3 weeks of being discharged from the hospital. This is according to the U.S. Department of Health and Human Services. Roughly 75% of wrongful discharges involve preventable mistakes. If you are not white, you have even more of a chance of having a bad outcome because you have higher mortality rates following most major cardiovascular and cancer operations. If you're Black, you have lower odds of undergoing curative surgery for cancer operations. And like a video that I posted before, if you are Black, you have a lower likelihood of your limb being salvaged through revascularization before amputation. Non-English speakers or those with a low health literacy may not understand discharge instructions clearly, so they are more likely to have poor outcomes after discharge. There are so many reasons why there are unsafe discharges, but they include mostly poor communication, inadequate planning, insufficient follow-up care, lack of understanding of insurance and authorization for the hospital workers. Therefore, they're discharging without everything being ready and set up for that patient. A patient who cannot walk, bathe, eat, take medication on their own is not a safe discharge, and not arranging the proper support is dangerous. If a patient has a willing caregiver, great, but handing a bunch of paperwork is not teaching and training. Can they manage a drain? Do they understand the new medications, and do they understand the warning signs of a complication? So the question is, how can you advocate for yourself? Because you're going to be hard pressed to find someone in the hospital who is going to adequately advocate for you. Document everything. Keep a detailed record of conversations, including dates, times, names of the healthcare professionals that you spoke to about your questions and about your concerns. What was discussed? What were the concerns you raised, and what did they do about it? Keep all of the paperwork that is given to you and all of the notes that you have documented throughout your hospitalization. And if you are a caregiver, make sure you're keeping all of this information. You may not get the outcome you want and the advocation and the proper setup that you need, but I bet that if you are documenting names, dates, times, who you spoke with, sadly, to some level, you may get a few extra thoughts of concern because you are clearly understanding, or at least trying to understand and documenting everything. In a perfect world, our healthcare would be covered, it would be adequate, it would be safe. But we certainly do not live in a perfect world here in the United States, and we must learn to advocate for ourselves and our loved ones. Follow me for more tips on navigating this crazy healthcare world that we live in, and how to advocate for yourself or your loved ones.